Well, we're here with Dr. Shluper, a dentist from Bloomfield in New Jersey. Dr. Shluper, tell us a little bit about your practice. Tell us a little bit, what type of practice you are having, because as patients, before we go to a dentist, we want to know, what's this guy's philosophy, basically, before we even ever walk in there.
Yes, Helmut, thanks for asking me. I always enjoy seeing people happy with their smile. When they come to the office, I try to make them look happy, look satisfied. Something that's very unsightly, something that is looking disgusting. We're trying to fix it before he leaves and goes home. When there is anything that bothers him the most, that's the first thing that we treat. If people missing some teeth or anything that they want to correct right away, he will receive it at the same time, at the same day, as much as possible when he comes to the office.
All right. Are you seeing? Are you having a problem with your earpiece, Dr. Shluper?
A little bit sliding out.
Okay.
Yeah. Okay.
All right. So, Dr. Shluper, are you seeing whole families? Like, are you treating children and normal people? By normal people, I mean age as well as elder people who may be needing or wanting dentures. Is that all part of your practice, or you, for instance, not seeing children, or who can come to you?
Children. Starting from the age of 12, I would say younger as well, starting from the age of 6. We see adults, we see people that need denture, and we see lots of young adults. We're trying to prevent them from getting any dental deterioration, so they will keep their own beautiful smiles, their own beautiful teeth.
Great.
Always the best teeth are your natural teeth.
Beautiful. So you're always putting a lots of attention on prevention.
Yes.
An ounce of prevention is worth a pound of cure, right?
Yeah. Up till now, the best root canal is your own tissue inside of your root.
Right. And the best tooth is your own tooth, even though you guys make good implants, and you are doing implant dentistry, you're doing periodontal disease treatment, you're doing root canals, you're doing dentures, you do extractions, even wisdom tooth extractions. You do all that stuff, right?
Yes, we do. We do replace teeth. Our goal is of course, to prevent the need for that, but when it's needed, it is done.
Great. Wonderful. And tell me, Dr. Shluper, what made a gentleman like you becoming a dentist in the first place?
Well, dentistry is my passion. I enjoy working with teeth, make them look beautiful. I enjoy working with such a small space. I do use my microscope. That small space look like if I were looking at the wide cinema movie.
At the Grand Canyon, I guess, huh?
Yes, it's very exciting when I see such a tiny spot with my microscope. It makes the whole view like you've never seen it before.
Beautiful. Well, all right. So you really enjoy it. And, you know, I've heard many people saying, and I think I fall myself under this category, that, you know, I'm one of the type of people who not never, that's exaggerated, but almost never worked a day in his life. And yet, I'm for purpose a workaholic. And the reason is I love what I do. And then it really shows through from your face, just looking at you, that when you talk about dentistry and when you talk about seeing little problems in a tiny tooth, which then to you look very big because you see them with a microscope, that you're really happy and that you're very happy about being there to do preventive dental care. You know, people don't realize that dentistry is the most preventable branch of medicine. No medicine, from a stomach belly ache to a cold to a migraine headache to back pain, whatever it is, nothing can be cured and predicted as precise and as exact than and prevented for all purpose than dentistry. Would you agree with that, Dr. Shluper?
Yes. The teeth are located in the most exposed environment in our body. It is prone to get decay since it's exposed to the air, to the food, to the grinding of the food, to various kind of trauma. It is a very tough environment. So here we are to preserve them.
Right. Well, wonderful. Well, Dr. Shluper, thank you very much for talking to me. I'm going to be talking to you a lot more about very specific dental problems and the ways on how to fix that. But thank you very much for now. And it's nice to know that the patients who do come to you really have somebody there who just simply loves what he does. Thank you very much.
Thank you, Helmut. Nice to talk to you.